So, yeah, can you just introduce yourself briefly, Dr. Musa?
Okay, my name is Musa. I'm working here in Care India, both as the country director as well as the chief executive officer for Care India right now. I've been here since January, but I have been quite familiar with Care India's program as well as its journey towards transformation for the last few years. Since I was also working in the region, so I know from that perspective. So I'm quite excited to be here. To move on from here, you asked me the question that why.
What is your big
why Care India?
Care India is becoming a national entity.
Yeah. It has various dimensions, but if I speak in one word, that in order for us to really have a meaningful impact at this scale in the coming days, in the changing context of India, it is important that we really need to transform ourselves into a national entity. What it would give us, that as we become national entity, it would allow us, first of all, to do better advocacy, number one, primarily by becoming more legitimate. Because when you talk about advocacy, it's talking about challenging and facilitating changes in the underlying relational issues and structural issues that kind of fuels poverty. In order for us to really address that, we need to really have legitimate presence with legitimacy on the grounding in the country. So that's one. Second reason is, as the country is changing, especially with the economic growth that is taking place, we can see that macroeconomic growth is taking place and the wealth and assets is accumulating at certain level of population. By being national, we can help in mobilizing that resource from where it's being accumulated to benefit poor. In other words, we can have local resource mobilization. And in order for us to play that role, along with others, we have to be nationalized. Third one, as I said, that in order for us to do the program that really challenges and changes power relations, we really need to be a local entity. So all this really demands us to be a local organization. It's not just about impact, it's also increase our legitimacy and relevance. So that's the primary reason why we are taking it. If we don't do it, in a few years' time, our relevance and legitimacy will be questioned. Our ability to have impact will be questioned.
And how do you see Care India evolving in the next, let's say, 5 years?
Actually, we see Care India, when it's evolving, it's in one hand it's becoming locally grounded, but also in another hand it's becoming truly global by becoming a real active member within the Care International Confederation, but also not only Care International Confederation, in the larger global force dedicated to ending poverty. In order for us to be able to do that, in one hand we will be a knowledge leader, by which we will be generating knowledge from our programs on the ground. We will be also scouting knowledge from various other sources that works here, and as well as then we transform that knowledge into evidence that would allow us to really influence various parts of global institutions and global system. So definitely that will be one of the role. By being global, we will be contributing to really transforming the Global Care International Confederation. Again, by bringing knowledge, by bringing Southern voices, by bringing our enthusiasm and energy, and by bringing the power of South in that whole process. But also at the same time, we also see that by being there, we can also bring the learning and knowledge from the rest of the organization globally into India. So it will be a kind of two-way process. And I see that in future, Care India will play that role of global as well as local.
Yeah. And I know you have 3 main program areas, livelihood, health, and education. Can you just elaborate a little bit about your plan in terms of livelihood and how you see Care India taking on that in the near future?
You know, when we talk about livelihood, it's basically about economic empowerment. We believe economic empowerment is one of the key drivers, and if we can work on that, then social empowerment follows. And therefore, we really want to work on that. But be it livelihood, be it health, be it education, we all see these are the vehicles for really addressing underlying structural and systemic cause of poverty. So we want to emphasize on that, But and we want to emphasize on those three areas, both during emergencies and in between emergencies. So I want to make sure that that's understood well. Now, in the particular livelihood area, right now our focus is a lot on women, because our India's focus is on women and girls from the most marginalized communities, most poorest communities. Therefore, our livelihood program will be focusing on women, and women linking them with agriculture and the market, women and linking them with their ability to really access resources and take the advantage of India's growth. So therefore, we'll be focusing on a lot. It's not just only about income generation, but also we want to see that income, women would have control on that income. So that's one of the areas we'll be focusing. Right now we are going heavily on this women and agriculture. As you know, you visited microinsurance program, that's one of the tools. We are also active in various types of micro finance program. We'll be working with a number of partners basing on our kind of learning from the past on various micro projects that would allow us to move in the women and agriculture, women and livelihood area. But basically livelihood is one of the focus area to help us really pursue the underlying cause of poverty that we want to focus on.
Yeah. The last question, I mean, what will be your key message to our constituent in the US, because we are going to publish this on YouTube?
Okay, no, basically this is a time when it's not about North, it's not about South. If we are serious about addressing poverty and marginalization, both South and North needs to work together. It's the globalness of the work that is important for us to really address poverty and marginalization, because poverty and marginalization does not exist in a community just because of that community. It exists because of the systemic issues at various levels of the global system. So my message to our colleagues in the US would be that it's time to even work together more strongly. Not just US and India, it's about not just North and South, it's about North and North, South and South, North and South, and overall it's a global movement. And in that role we play comparative advantageous role as we have in different places. So it's time to really strengthen our working together. And I would really invite US to really play and support Care India in that role.
Thank you, Dr. Musa. Good luck.